is Dr. Claudia Anderson from Family Dental Care Park Ridge, and welcome to another segment of Word of Mouth Wednesday. Today we're going to talk about a subject that makes many people a little bit uncomfortable. We're going to talk about halitosis, or bad breath. The term halitosis is a combined origin. Halitus comes from the Latin word meaning breath, and osis comes from the Greek word meaning medical condition. So together, halitosis means a medical condition that involves the breath, or bad breath. There are many causes of bad breath, and we're just going to talk about a few to see if there are things that you can do to alleviate your bad breath if in fact you think you have it. Now, just as a side note, many of us today are very, very obsessed with our breath. And so we're constantly worried that we have bad breath. We come in close contact with people nowadays in our businesses and in our social life. And so we're very worried about our breath, and we tend to chew gum, take mints, use breath sprays. The reality is most of us don't really have bad breath. But if you think that you do have bad breath, if you've been told that you do, if your doctor has suggested that perhaps you have bad breath as an issue, here are some things that you might want to consider. One of the causes of bad breath can be dental-related problems, and that is very intuitive because our breath comes from our mouth, and so if we've got some dental-related problems, perhaps in fact they are causing bad breath. So things like an infection in the mouth, abscesses, if you've got teeth that are badly decayed and you just haven't had them taken care of, all of those situations create an accumulation of bacteria, and the bacteria is going to cause bad breath. So taking good care of your dental health is going to really eliminate any potential for bad breath. Brushing your tongue is a really good way of eliminating some of that additional bacteria that may be causing bad breath. So when you're brushing your teeth twice a day, make sure you include some time in that brushing to brush your tongue, because that really will eliminate some of that bacteria that just kind of hangs around. So mouth conditions. Another situation that can cause bad breath is dry mouth. And so as we get older, sometimes our saliva glands produce less saliva. And so in that decreased amount of saliva that is being produced, we aren't allowing flow of the bacteria, the food breakdown products that we normally would have had. And so as our mouth becomes drier, the plaque and bacteria stick to our teeth for a longer amount of time, and that bacteria again can cause bad breath. So drinking a lot of fluids helps to decrease bad breath if your problem is dry mouth. Also, an intake of citrus fruits, oranges, grapefruits, lemons, lemonade, limes, really helps to promote saliva, and so you're going to decrease the amount of dry mouth that you have. So that's a good suggestion. Tobacco, if you're a tobacco user, either smoking or chewing tobacco, that certainly is going to increase your bad breath meter. You're going to have more of a chance of having bad breath, and so certainly decreasing or getting rid of that habit altogether is going to be helpful to you. Certain diseases and medications cause bad breath. Diabetes can cause a certain type of breath smell. Kidney diseases can cause a certain type of breath smell. Some of the medications that we use, some antibiotics that we might have to be on, can cause breath smell. So sometimes it's not even related to the oral condition. So you might want to talk to your doctor about that. So those are some of the reasons that bad breath occurred. So what can we do if we have bad breath and we just want to take care of it in a natural way? So I'm going to talk a little bit about some of the solutions that you can try to see if they help eliminate bad breath. We've talked about brushing your tongue. That's a really simple solution. Brushing your tongue each time you brush your teeth is going to decrease the amount of bacteria that accumulates in the nooks and crannies of the tongue. Drinking lots of fluids, really going to help. Whether or not you have dry mouth or not, keeping a good hydrated mouth, drinking lots of fluids during the day, especially water, is really going to help to decrease the bacteria that just sticks around in our mouth and causes bacteria. Drinking tea that has parsley in it, so steeping some parsley in hot water, boiling water, and creating a parsley tea is a very natural way to decrease bad breath and keep your breath feeling very, very fresh. So that's another solution. A solution that is also kind of a natural solution is to use tea tree oil. If you put a drop of tea tree oil in your toothpaste, so you put out a little toothpaste on your toothbrush and you put a drop of tea tree oil on it, that really is a very natural way of creating very fresh breath that lasts for a very long time. You can also create a mouthwash with tea tree oil. You can use some warm water and put a couple of drops of tea tree oil in there and rinse and spit. The important thing to remember of using tea tree oil, while it's a great solution and a great product, you don't want to swallow it, and so you want to make sure that you spit out the toothpaste and you spit out the mouthwash if you use tea tree oil. And one of the other things that I talked about was to increase your intake of citrus fruits. Citrus fruits, not only are they healthy for you from a vitamin C point of view, but they also really help to stimulate the production of saliva. So again, with or without dry mouth being an issue for you, increasing your saliva is always a good thing. It keeps the flow going, and citrus fruits are a great way. They taste great and they keep that saliva going. So those are some of the solutions that, other than the typical gum and mints, those are some of the natural solutions that you can try to decrease bad breath. And again, I want to reiterate that we do tend to be a little worried, maybe over worried about how our breath smells. And so there is a very good possibility that while you think you might have bad breath, the reality is that you don't. But it's always a good thing to talk to your dentist about it. Many people come to our office and their concerns are their oral health, if they have cavities, and if they've got bad breath. And so certainly you can talk with your dentist openly about the fact that you may or may not have bad breath and what they might suggest that you do. Talk to your doctor. If you've got medical conditions or medications that you're taking that create a bad breath smell for you, then maybe talking to your doctor you can come up with some kind of solution. And oral hygiene is always a good option. So good oral hygiene, brushing your tongue and flossing and getting rid of the bacteria that causes bad breath is certainly a very easy way of taking care of it. So that's what we're talking about today, is halitosis, or bad breath. If you have any questions at all, please feel free to contact us. You can give our office a call at any time or email me at info@parkridgedds.com. And remember, as always, we love making you smile.